Welcome to the Driving Quality Navigating Healthcare with Leading Age Illinois and Iowa webcast, where this month we will be discussing an overview of the quality measures included in the Centers for Medicare and Medicaid 5-Star program. I am Kelly Van Reet, the Director of Clinical Services with Leading Age Illinois and Iowa, and I want to welcome back my colleague Sam Heibel, who joined me on the first webcast. Sam, do you want to quickly introduce yourself to our viewers?
Thanks, Kelly. I'm pleased to join you again. I'm Sam Heibel, Director of Advocacy and Engagement at Leading Age Iowa. I advocate on behalf of our members at both the state and federal levels and work to ensure our members get the most value from their membership through timely resources, meaningful connections, and engagement opportunities like this webcast. Kelly, do you want to get us started by talking about what we will cover today?
Absolutely. Today, we were going to talk about what measures are included in both the long and short stay quality measures of the 5-Star program and why some providers may be excluded from the short stay measures. Additionally, we will outline individual and overall point values and help providers develop a strategy to apply to their quality improvement efforts. While we feel like it is important information for you to understand the different programs and the quality measures, the vital aspect of these webcasts is how we can help you improve the quality of care that you provide, as that is what Leading Age Illinois Iowa members pride themselves on.
Another thing to add to that is the advocacy perspective when referencing quality. As Jason and I approach our state and federal government, this is a key approach we use. When the media has tried so hard to paint all nursing homes with a negative brush, we are able to provide an overview of members' quality measure data that shows how our members should not be included in that broad painting.
Sam, that is so important. As a former nursing home director of nursing, I drove my team from a 3-star provider to a 5-star provider by really focusing in on our quality measures. One measure at a time, we were able to slowly but effectively improve our star rating. In the coming months, we will focus on specific quality measures and what triggers those measures, along with how you can use this information to narrow down specific residents that are included in the measure so you can improve those measures. Let's get started on today's discussion. Here's a picture of the Leading Age 5-Star report. There are a couple of ways that you can access this report, including an email that I send out on a quarterly basis, which is usually at the end of January, April, July, and October with the quarterly refresh. Providers can also access their individual reports on the Leading Age report portal, which can be found by logging into your Leading Age National account. If you need assistance signing up for a Leading Age account, please reach out to your state affiliate by contacting info@leadingageiowa.org or info@leadingageil.org. The Leading Age report portal is updated monthly. However, the only data on the 5-star report that is changed monthly is the health inspection rating. The quality measures are only refreshed quarterly. You can also find your star rating on the Medicare Care Compare website, but it isn't going to break it down into the point values like the Leading Age report will. Additionally, you can access quality measure reports in your facility iKeys folder. If you're not familiar with accessing a report on the iKeys system, you can locate training materials and user guides on the website cited on this slide. For both long and short stay measures, you must have at least 20 nursing home stays over the course of a year. If you have less than 20, the quality measures will include the actual number of MDSs plus the state average for the remaining, which may alter your results if you were to have the actual number of residents present, particularly if you are a higher performing provider. Additionally, the points are assigned to providers based on a curve, with the highest performing providers achieving full points for the measure and the lowest performing providers receiving 15 to 20 points depending on the total point values that are evenly distributed on that curve. So, how other providers are performing may impact how your scores improve or decline over the next quarter. On this slide, you will see a table of the short stay quality measures identified by their point value and where the information is gathered from. There is a total of 800 points when you're looking at the unadjusted rate. You'll note in a couple of slides as we look at the total point values that CMS adjusts the 800 points in the short stay measures to a comparable 1100 points overall, which is the same as the long stay measures. There are 3 MDS-based quality measures, including the resident's discharge function score, which looks at the percentage of short stay residents who are at or above an expected ability to care for themselves and move around at discharge. New or worsening pressure ulcers, which includes residents who are newly coded with a pressure ulcer, or their previous pressure ulcer is at a higher stage than coded on previous MDS assessments, and a percentage of residents who received an antipsychotic medication for the first time when they did not have an antipsychotic medication coded on their initial MDS. There are also 3 claims-based quality measures, including rehospitalizations, which include hospital inpatient or observation stays within 30 days of SNF entry or re-entry, emergency department visits or ED visits, which looks at new admissions with an ED visit within 30 days of entry or re-entry, and successful community discharges, which includes discharged residents that did not have an unplanned hospitalization or death within 31 days following discharge from the SNF. Additionally, there are 2 measures that are risk adjusted under the short stay category, including the SNF discharge functional score and the new or worsening pressure ulcer measure.
Thanks for sharing that, Kelly. It really underscores the impact of focusing on one quality measure at a time. Providers can use this data not just to track their performance, but to pinpoint exactly where improvements are needed and which residents are included in each measure. That level of detail allows teams to take focused, strategic action, just like you did, to steadily improve outcomes and ultimately their star rating. It's about turning insight into action, and this report is a powerful tool to help do just that.
The long stay measures are also identified by MDS or claims-based measures and have point values of 100 or 150 for a total of 1,150 points. MDS long stay measures include a decline in mobility, which measures the resident's locomotion between MDS assessments, increased assistance with activities of daily living or ADLs, which includes measuring necessary assistance with ADLs between the MDS assessments. Pressure ulcers, which includes residents coded with a stage 2 through 4 pressure ulcer. Catheters coded on the MDS with certain diagnoses excluded from the denominator. UTIs, falls with major injury, and residents coded with using an antipsychotic medication. Additionally, there are 2 long-stay claims-based measures, including the number of unplanned hospitalization or outpatient observation stays over a 1-year period, and the number of outpatient ED visits that occurred among long-stay residents during a year period. And just for your information, a long-stay resident is defined as those who reside in the nursing home for more than 100 days. Now is likely a good time to mention that CMS issued a QSO memo on June 18th that outlines some planned changes with the next refresh for antipsychotic measures. They are going to expand where the information is collected from when antipsychotics are included in the numerators. CMS will not only be relying on the nursing home to accurately code the use of antipsychotics in the correlating diagnosis, but will cross-reference claims data that may support the MDS coding or may oppose the coding, which will include a resident in the numerator where they would not have been previously. For example, if the MDS codes the use of an antipsychotic during the reference period and codes schizophrenia as a diagnosis, which would typically exclude the resident from that numerator. But through the new process, CMS does not have evidence from their claims that the individual received mental health services supporting the schizophrenia diagnosis, then the antipsychotic will be included in the numerator.
I think that this is a good time to bring up the aging services networks that are established in both Illinois and Iowa. In order to be included in the aging services networks, nursing home providers must meet a threshold for quality measures. As I've worked with the aging services networks, they've explained that the reason for the threshold is that it provides leverage for better negotiated rates and incentives when the providers are high quality providers that are included in the network agreement. From a benefit perspective, a group of providers that all exhibit high quality are much more attractive than a lone provider with a lower number of skilled stays. You can reach out to your Leading Age state affiliate if you are not a member of the Aging Services Network and are interested in how you can join.
Dan, previously I was a Leading Age Iowa member working in a community who was a member of the Aging Services Network. And as an administrator, it was very beneficial to not need to worry about credentialing with the individual insurance companies, as well as knowing that we were getting the best possible rate we could. Finally, here is a table of the quality measure star rating with the associated point values. You'll note that you need to adjust the short stay point values in order to accurately determine your overall point values. However, this may play into how you plan your quality improvement projects.
While you're talking about quality improvement projects, what are some strategies that you think our members can incorporate to improve their quality measure ratings?
That's a great question, and one that will take some analysis of where you currently are and where you want to be. Let's take a look at some real life examples to help members. As a reminder, we can assist you with some recommendations under a member benefit also. So if you want to see what our thoughts are on where you could focus your attention, please let us know. So first, let's take a look at nursing home number 1. You can see from the table on this slide that nursing home number 1 is a 3-star overall out of 5 possible stars with 4 stars in quality measures. However, this nursing home does not have enough qualifying short stays to have the short stay measures count. So when you look at this report, you may see the state averages included, but the data isn't included in the overall QM score and defaults to the long stay measure score. I included a couple notes when looking at the overall 5 stars, such as the majority of the health inspection points are from the recertification period that is the longest and worth the least amount of points in the overall score. Also, I noted that for the quality measures, they will need to gain 85 points to move to 5 stars in the category. So now let's take a look at the quality measures specifically. As a side note, CMS is also revising the health inspection rating and will now only review the last 2 recertifications, accounting for 75% of the weight in the first cycle and 25% of the weight in the second cycle. So this will help individuals who may have had an IJ or a harm level deficiency in that third cycle, which will now be removed. However, in the second cycle, CMS will still include complaint and focused infection control surveys for the second and the third years. So here's a breakdown of nursing home number 1's 650 points that resulted in the 4-star long stay measures, an overall quality measure rating. Sam, do you want to take a guess at a way that this nursing home could work towards obtaining a 5-star rating with the quality measures?
I'm not an expert in this area, but there are several areas where the nursing home is not achieving all the points possible. This would lead me to believe that they should focus on those areas.
Somewhat. So there are usually a few ways that I look at this when looking at the overall picture. So first, what is the goal of the nursing home? If it's to improve the overall 5-star rating, there may be additional areas such as staffing or health inspection that they can improve on easier than quality measures. So with that being said, if the nursing home could improve their quality to a 5-star, they could become a 4-star nursing home based on how the overall 5-star score is calculated. If you're interested in learning more, there's another webcast specifically looking at how that is calculated that's posted on our YouTube channel. But looking specifically at the quality measures, there are two ways that I would advise them to go. So this slide highlights 3 areas where they have the most points to gain, as you said, Sam. While these are the quality measures that they have the most to gain, hospitalizations and ED visits are often difficult to improve because there are outside factors that drive this, that nursing homes feel like they have little control over. Things like a provider saying, just send them to the ER so we can evaluate them, instead of understanding what the nursing home can do to help diagnose the patient prior to transferring them to the ER. The other limiting factor is the resident or their responsible party who is also unaware of in-house diagnostic procedures that can prevent a transfer to the ER. More to come on this topic next month as we take a deeper dive into this quality measure specifically. The other one that I believe is often more difficult to improve is falls. Most nursing home residents are at a high risk of falls just because of their age and likely impaired mobility based on their need to have a nursing home level care. Improving falls usually takes a multidisciplinary approach to see gains. However, even moving up to the next point level in 3 areas will not cover that 85 points necessary to move to a 5-star rating. So now, to look at this a little differently, this slide highlights, in my opinion, some of the easier quality measures to work on for improvement. So I've also highlighted falls with the major injury in this one. While a robust falls program is always a great idea, and on the more complicated side, you could just look at individuals who are triggering for the measure and identify opportunities for improvement among those residents. Again, this is only 3 areas, which may not bring them to high points to improve to an overall 5-star, but you could also move a couple of quintiles in points to achieve that goal. Again, as we move through these webcasts, we'll discuss ways to improve these individual measures for improvement.
Kelly, I think this is a great strategy, and I like looking at more than one option. Do you have another example that is a little more complex?
So yes, let's take a look at nursing home number 2. Unfortunately, nursing home number 2 is having some issues in a few categories, but I wanted to look at this one for a couple of different reasons. First, it includes short stay quality measures to understand the impact that short stay measures can have on the overall score. And secondly, there are a few measures that are fairly close to the cut points that can impact the score and how to dive into those areas. So as you can see, overall, the nursing home is a 1-star nursing home because of the health inspection rating. They have recently had a couple of surveys that were not in their favor and have a really high point value that is accounting for half of their points in that category. Unfortunately, they don't have any additional areas that have 5 stars that can help bring them up to a 2-star level. So breaking down their short stay measures, which are currently triggering for at 4 stars for 719 points. So at 720 points, they would move to a 5-star for short stay measures. So quality measures, quality improvement, I highlighted the 2 areas. Again, the ones that may be the most difficult to improve, that have the most room to gain for points. Really, the other 2 measures that are not achieving the full points are still pretty high and could be an area that they look to possibly increase a couple of points. So breaking down the long stay measures, they need 30 points to move to a 3-star in long stay measures. So you may note a few areas that we can look at for improvement. Again, the most points to gain include possibly the most difficult measures, but there is ample room to improve on some of the easiest as well. Putting those two improvements together brings us to a short stay score of 720, a long stay score at 566 for an overall score of 1286. While this will still leave them at a 1-star overall because of the health inspection rating, it may make them more marketable to an aging service network or insurance company for improved reimbursement or incentive payments. Unfortunately, to move to a 5-star in the quality measure category, they would need to improve by an additional 170 points, which may be achievable with time, but maybe a little too far reach for a short-term improvement.
Kelly, thank you for such a brief but robust education on the quality measures that are included in the 5-star program, and most importantly, understanding it well enough to help members with improving their measures if they need it. Having knowledge in this area at the tips of your fingers is such a great incentive for Leading Age Illinois and Iowa members.
Thank you for helping me with this webcast today, Sam. Join us next month as Jason Speaks joins me again to discuss rehospitalizations and ED visits. Before you go, I just want to mention that we have a survey posted on our Driving Quality website for you to complete. So feel free to give us feedback on these webinars, including what you like, what you think we could do better on, or any other suggestions that you may have.